How worried are you?
Well, what we're doing is we've taken swift precautionary steps. We don't fully understand this new variant at all yet. It's got 50 mutations, roughly, of which 32 are in the spike protein, the bit that connects the key to our cells and infects us. So that is concerning, but it's still early days in terms of understanding how it actually reacts in terms of transmissibility, in terms of how dangerous it is. Therefore, let's let the scientists do their work, but we've taken some proportionate, measured steps to help slow down the spread and the seeding of that variant while they do their work. Hopefully, it won't be a huge concern, but we don't know. We've got to be precautionary in this.
South African Medical Association, the chairman of that, saying the symptoms are very, very mild.
Well, I did see that report, and I think that that doctor was talking about symptoms in predominantly younger people that they'd experienced it in. We don't know how it'll react in terms of older people or with the vaccine. So hopefully that is what we will see, not just in South Africa, but around the world. But we've just taken those precautionary steps while we seek to understand how it works.
Is it about now when we think, you know what, we should have given them more of the vaccines for COVAX? We've only given 11% of what we promised.
Well, if you look at South Africa, I think the president of South Africa or government officials have said there is no shortage of vaccines in South Africa, which is where we've seen this new variant originating from.
The greater continent.
But then if we're looking more broadly, and I think you and I spoke about this when last you interviewed me, we've pledged 100 million doses by next June. We've delivered, I think you're absolutely right, about 11% of that so far. We're on target to deliver just over a third of that, have delivered over a third of that by the end of this month.
The speed of that?
And then we will deliver the rest next year. I think that's a reasonable and swift rollout, and we're still, I think, the second biggest donor supplier of vaccines through the COVAX programme after the United States, I think. So can we do more and do we need to ramp it up? Yes, but are we on target to deliver on that pledge? Yes, we are.
OK, so let's talk about what's going on at home then. Give us an update this morning. How many cases have we got?
So there are you'll have seen in the news overnight 3 confirmed cases. I'll be honest with you and your viewers, I would expect that to rise. We don't know by what speed or by what numbers, so therefore what we're doing is trying to slow it down, but we're clear we can't stop it, and we're trying to give ourselves the time to understand how it works and how it interacts with the vaccine. But that's why we're putting in place these sensible precautionary measures to help slow it down.
You say slow it down, but the flights were coming in from South Africa. People were allowed to get off the plane, mingle with hundreds of other passengers coming from wherever, and then go home. We saw in Amsterdam, people were isolated on the aeroplanes and they had their checks before they were allowed off.
Well, I'd say I think we've moved, possibly globally, among, if not the fastest countries in the world. I think South Africa identified the genomic sequencing on Tuesday. On Thursday, even before this was designated as a variant of concern, which happened on Friday, I think, from WHO. On Thursday, we'd already set out, my boss, Sajid Javid, had set out very swift steps to tackle this, both in terms of borders, but also in terms of the plans around testing and PCRs.
My point is, why did we let them get off the plane?
I think we moved very swiftly. When people were returning or were in flight, they were met by health officials. We would expect them to travel to take that PCR test. And, of course, now we've got the 10 countries, I think it is, on the red list. We will be expecting people, before they travel, to have booked a quarantine hotel. So I think we moved very swiftly, proportionately but swiftly, and tackled what there always is, which is the moment you make an announcement like this, there are calls from people for you to delay it, to give people more time. There are others saying do it immediately. I think we've struck the right balance here in providing that response, but allowing people to get home.
What about people who are in South Africa and other countries there, ready to come back, and now they have to pay £2,250 to stay in a hotel? Could be a family of 4. That's £10,000 that they don't have. What happens there?
Well, I think I do appreciate that's extremely difficult for people who will have gone on holiday, gone to visit family, or gone for family events. And suddenly find that this has changed. Sadly, we've seen over the past year and a half, year and 3 quarters, this is the nature of this virus. We can never, with total predictability, guarantee when someone travels abroad that there won't be something of this sort. Now, we've managed to avoid that largely in recent months. I think the last new variant we saw was...
South Africa only just came off the red list, didn't it? And yet some families now could be £10,000 in debt through no fault of their own.
Absolutely. I'm afraid that's sadly, and I'm very sympathetic to that, but that's sadly the nature of this virus and what it does. You're right, it did come off the list. pre the identification of this new variant. We've always been clear that was a risk, the new variant. All credit to South Africa for its amazing genomic sequencing and testing programme that identified this new variant very swiftly. And they told the world, they were very open about that. And they've been exemplary in how they've done that. But sadly, until we understand it, we've got to take those precautionary measures.
Penalised for being so open?
Well, I don't think they're being penalised for being open. We've seen with other countries, when a variant's identified, we've got to take, as have other countries, the necessary steps to help stop that seeding and spreading. Other countries, I think, have been even tougher on some of their border restrictions. I think, I may be wrong, that Israel's closed its borders overnight, and other countries are putting in different levels. So each country is reacting in its own way. We believe that we've reacted in a proportionate and measured way to help address the challenge of this variant while we seek to understand it.
So what else are we doing here? The booster programme, what's going on?
So the booster programme, the Secretary of State, Sajid Javid, as you will know, has asked the JCVI, the Joint Committee on Vaccinations and Immunisations, for advice urgently on, bringing down the gap, potentially, between second and booster jabs, but also in terms of whether the booster programme should be extended downwards in terms of age range. We're awaiting that advice. I hope it will come, hopefully later today. I don't want to prejudge it. I don't know what.
So our understanding is that it's anybody over 18 gets a booster.
But I think that's what they are looking at. I don't know what they're going to recommend. I haven't seen the advice. You and your team may have done, but I haven't yet because I don't think it's been formally delivered. But we'd expect that within the coming hours.
OK, so sometime today we'll hear further on what's happening. And the gap between the second booster and the second vaccine and the booster, that could come down to 5 months. Potentially,
but we'll wait for their advice. That's what they're there for, and we will look very carefully at the advice they give us, hopefully in the next few hours.
OK. As far as the symptoms are concerned, we don't. How do we actually know whether people have got the Omicron variant or it's the Delta variant, or whether, because the symptoms are very similar? They are, and that's why we recommend people with symptoms. You and I and others will probably be taking lateral flow tests, if not daily, every couple of days or similar, or regularly. What we're saying to people with symptoms is that they should take a PCR test, because the PCR test gives the facility to do the genomic sequencing that helps us identify which are Omicron, which are Delta. The lateral flow test won't do that, but the PCRs will, and therefore when people have symptoms, or if they test positive on a lateral flow, again, that's why we're advising a PCR test to allow for that genomic sequencing. So why did we do away with the PCR test for people coming back from holiday? We reacted in what we thought was a proportionate way to the level both of threat and knowledge we had of existing threats. Time and again, this virus has shown us that we can't be complacent, which is exactly what you were saying. But we struck an appropriate balance there. We still had the surveillance programme, which allows us to genomically sequence through PCRs to understand whether new variants are coming through. And we have to strike a balance. It goes back to your point just now, Kay, again, about the price of things, the ability for people to go abroad on holiday. We think we've struck the right balance. But when a new variant comes along, we got that through genomic sequencing. We're now using PCR tests just to identify where that is in the community, if it gets into the community more broadly, but particularly for travellers coming into this country. So we were risking the health of the nation because of cheap lateral flow tests? No, I don't think we were risking it, because I think on the basis of why have we changed on the basis on the basis of what we were seeing with existing variants, knowledge of them, our scientists understood those existing variants, lateral flow tests and similar were appropriate. What we're seeing now is a new variant. While we seek to understand that over the next 2-3 weeks, which is hopefully all it will take for scientists to be able to actually understand transmissibility, how dangerous it is, impact on vaccines, it's right that we use the PCRs to better understand that genomic sequence and where it may have spread in the community. As I say, I would expect, I'm afraid, more cases in this country, but we need to work out where they are. How long do you expect the red list to be in place for? Well, we'll follow the evidence, but in 3 weeks' time, the Prime Minister and Secretary of State... Christmas Eve. So just shy of, I think. But we'll review the mask wearing and the travel restrictions. I want to come on to mask wearing in a second. But... Of course. That gives enough time for us to see how this disease behaves. We know that you and I have talked about it many times, the lag time between infection, between becoming ill, between serious illness. And equally, it gives the scientists time to do that work on this. So it gives enough time to understand the impact of it. But people who've booked their Christmas holidays, what are you saying to them? Cancel them? No, what we're saying is follow they're all red list countries. You know, people shouldn't be travelling to them, so that is difficult.
in this context.
So if you fly to
appreciate
South Africa,
that.
cancel your holiday.
But what we've said is if people are coming back from South Africa, we've put in place the quarantine hotels. That's, again, from what you were just saying, quite rightly you highlight, that's a big cost. And I think people will think about that very carefully. Other countries, we've said PCR testing, etc. We're not saying cancel your holidays to France or other countries, but we have put in place that proportionate testing and border control.
But people who are going to a red list country, it's on the red list at the moment. They really shouldn't be. Well,
I'll be honest, and I've said it before, is we cannot say what will happen there over the coming weeks, and therefore, going to your earlier point, in travelling at the moment with this virus, particularly with a new variant around, there is an element of risk there for people. So
might you review that before 3 weeks?
We need to have the 3 weeks in order to understand how this new variant works. I hope that the scientists and those researching it will get more information more quickly. And actually, one of the things we did last week was we were open as quickly as we could be with the British people about what we were finding, even without fully knowing how this new variant worked. We wanted to level the British people, which is what my boss, the Secretary of State, did last week.
Mask wearing, you mentioned, you touched on that. It's going to be tricky for your boss, isn't it, your big boss? He's never wearing a mask.
I don't think so. I think he will comply with the rules, just as we all do. When I was sitting out, when not being interviewed, when I was sitting out in your lobby earlier, I was wearing my mask, took it off to do interviews, and then we'll put it on again when I leave your studio. I think everyone will do that. When, for example, in shops or on public transport, that's what we've said. That's what we will be putting in the regulations, and we would expect everyone to comply with the law.
Why not in pubs and restaurants? I mean, can you not catch COVID in a pub?
Well, equally in pubs, restaurants, hospitality venues, partly we've always seen this throughout the pandemic. People are eating, drinking, etc. Clearly impractical to wear a mask in those circumstances. Say a restaurant, a lot of time is spent sitting down with your group, whoever you've come with, family, friends,
etc. If you're at the bar in a pub, should you put your mask on?
And ordering on that. Again, on that, we're not making it a legal requirement, but people will make their own judgments.
But why not? Why
because we believe that shops and public transport, often very confined spaces, take a bus or a tube.
Have you been into a London pub?
Or whatever.
It's mad.
Well, hang on, I'll come on to that. We think that's a proportionate response. It's a measured response while we understand how this variant works. We don't believe we need to or should do that in hospitality or restaurant venues at this point. And hopefully we won't need to make any further changes. Hopefully in 3 weeks we'll be able to scale back what we've done. But we're being honest, we don't know how this virus with this new variant behaves yet. So we've got to be measured in what we do.
My point is, crowded pub, standing at the bar, surely you should have to wear your mask then.
No, I think, well, if you're standing at the bar, chances are you're ordering a drink and then drinking a drink. And therefore, you won't be wearing a mask while you're drinking your drink. So
no,
I think
you go and get your drink and then you go back to your table.
Mm-hmm. But you're only going to be doing that for a brief period. Go to the bar, order your drink and come back. If you're in a tube, on a bus, you're likely to be on there 15 minutes, 20 minutes, half an hour. And we go back, I think you've been interviewing me now for a year and a half, almost 2 years. And when we were first talking about this, we talked about both distance but also the length of time you're in close proximity to an individual. Therefore, we think this is proportionate and it's the right precautionary balance to strike.
OK, we are out of time, but I mean, I have to have some sympathy for you. When are we going to see the back of this virus?
Well, I think the whole country wants to see the back of this virus. As Sajid Javid said, the pandemic isn't over yet, and we've seen that with this new variant. But we are in a hugely different place to where we were, as Chris Whitty said, with any of the previous new variants. That vaccination programme has made a huge difference in protecting our citizens, protecting our society and enabling us to open up. And the measures we're putting in place now, as I say, are proportionate, they're measured, while we understand how this works. So I think we've made huge strides forward, and I'm looking forward to a Christmas spent with family and friends. OK, and finally, could we possibly find ourselves in a position where you tighten the rules up even further within the next 3 weeks? It's not something I'm anticipating. Oh, I'd like to hear that. Good to talk to you. Thank you, Minister. Thanks, really appreciate it.